Every single day, your body is fighting a war you cannot see. On one side, there are inflammatory compounds, cytokines, prostaglandins, free radicals that are slowly damaging your joints, your gut lining, your blood vessels, and your brain. On the other side, there is your body's defense system trying to keep up. And if you are over 50 and dealing with chronic pain, whether it is in your knees, your back, your shoulders, or everywhere at once, that means inflammation is winning. According to the CDC, chronic pain affects more than 51 million American adults. That is 20.9% of the adult population. The standard medical response is medication that masks the pain but does not stop the underlying fire. But what if you could address the fire itself with food? Not medication, food. Specific foods with specific compounds that have been tested in randomized controlled trials and shown to significantly reduce the inflammatory markers driving your pain. I have been studying which anti-inflammatory foods carry the strongest clinical evidence, and today I am giving you all 20. Make sure you hit that subscribe button because we post new videos every week connecting nutrition science with what your body actually needs. Stay with me because number 12 reduced a key inflammatory marker by 42% in a controlled trial involving patients with inflammatory joint disease. And number 20 has the largest body of clinical trial evidence of any food-derived anti-inflammatory compound on this entire list. Here are 20 anti-inflammatory foods that reverse chronic pain instantly. Number 1. Green tea, the quiet shield. Green tea has been consumed across East Asia for thousands of years, not as a casual beverage, but as a daily health ritual. The compound that makes green tea relevant to this conversation is epigallocatechin gallate, or EGCG, a polyphenol that inhibits multiple steps in the inflammatory signaling cascade. EGCG works by suppressing the activation of a protein complex called NF-κB, which is the master switch that turns on the production of inflammatory cytokines throughout your body. When NF-κB stays activated chronically, inflammation becomes systemic, affecting every tissue from your joints to your cardiovascular system. Drinking 2 to 3 cups of green tea daily provides a consistent supply of EGCG and other catechins that help keep that switch from locking into the on position. Brew green tea at 175 degrees rather than a full boil because excessive heat can degrade the catechins and increase bitterness. Steep for 2 to 3 minutes. If you find the taste too astringent, a squeeze of lemon actually stabilizes the catechins and increases their bioavailability. This is a drink you can incorporate into your daily routine without changing a single other thing about your diet. Number 2. Broccoli, the cruciferous defender. Broccoli belongs to the cruciferous vegetable family, alongside cauliflower, Brussels sprouts, and cabbage. What makes this family uniquely anti-inflammatory is a compound called sulforaphane, which forms when you chew or chop raw broccoli, and an enzyme called myrosinase converts its precursor molecule. Sulforaphane activates a pathway in your cells called NRF2, which upregulates the production of your body's own antioxidant enzymes, glutathione chief among them. This is not adding antioxidants from outside. This is telling your cells to manufacture more of their own defense compounds, which is a fundamentally more effective strategy than consuming isolated antioxidant vitamins. The NRF2 pathway is one of the most studied cellular defense mechanisms in modern nutrition science. To maximize sulforaphane production, chop your broccoli and let it sit for 5 to 10 minutes before cooking. That waiting period allows the myrosinase enzyme to complete its work before heat deactivates it. Light steaming preserves more sulforaphane than boiling. If you must boil, adding a pinch of mustard powder after cooking can partially restore the enzymatic conversion because mustard contains its own myrosinase. Number 3. Sweet potato, the beta-carotene reservoir. Sweet potatoes get their orange color from beta-carotene, a carotenoid pigment that your body converts to vitamin A. Vitamin A plays a direct role in regulating immune responses, and adequate levels are associated with properly balanced inflammatory signaling. Sweet potatoes also contain a class of compounds called anthocyanins, particularly in the purple-fleshed varieties, which have demonstrated anti-inflammatory and antioxidant effects in laboratory studies. The fiber content of sweet potatoes supports gut health by feeding beneficial bacteria that produce short-chain fatty acids, and those fatty acids in turn modulate inflammation at the intestinal level. Bake them whole at 400 degrees for 45 to 50 minutes. Roast cubed sweet potatoes with olive oil and a pinch of turmeric for a side dish that stacks 2 anti-inflammatory ingredients in one preparation. Unlike white potatoes, sweet potatoes have a lower glycemic index, which means they produce a more gradual blood sugar response, and blood sugar stability itself reduces inflammatory stress on the body. Number 4. Beets, the nitric oxide engine. Beets contain betalains, the pigments responsible for their deep red color, which have demonstrated antioxidant and anti-inflammatory properties in cell studies. But the more significant contribution beets make to the anti-inflammatory conversation involves nitric oxide. Beets are one of the richest dietary sources of inorganic nitrates, which your body converts to nitric oxide through a pathway that begins in your mouth with bacteria on your tongue. Nitric oxide relaxes blood vessel walls, improves circulation, and supports the delivery of oxygen and nutrients to inflamed tissues. Better circulation to a damaged joint means faster delivery of healing compounds and faster removal of inflammatory waste products. Raw beets deliver the most nitrate content. Grate them into salads or juice them. If you prefer them cooked, roasting preserves more of the betalain pigments than boiling. Beet juice has been studied extensively in exercise science for its effects on blood flow and endurance, but the same vasodilatory mechanism that benefits athletes also benefits anyone dealing with inflammatory pain in tissues that need better circulation. Number 5. Dark leafy greens, the chlorophyll pharmacy. Spinach, kale, Swiss chard, and collard greens share a common trait that makes them relevant to chronic pain. They are all rich in magnesium, a mineral that participates in over 300 enzymatic reactions in your body, many of them related to inflammatory regulation. They also contain lutein, zeaxanthin, and other carotenoids with antioxidant properties, along with vitamin K, which plays a role in regulating inflammatory processes. The fiber in leafy greens feeds the beneficial bacteria in your gut that produce butyrate, a short-chain fatty acid that has been shown to reduce intestinal inflammation and support barrier function in the gut lining. A compromised gut barrier allows bacterial endotoxins to enter the bloodstream, triggering systemic inflammation that manifests as joint pain, fatigue, and brain fog. Aim for at least 2 cups of dark leafy greens daily. Sauté them in olive oil with garlic for a side dish that combines 3 anti-inflammatory ingredients in one pan. Raw greens in salads work well too, but cooking concentrates the minerals by reducing water content. Number 6. Whole grains, the fiber foundation. A meta-analysis of 13 randomized controlled trials involving 466 participants found that whole grain consumption significantly reduced HSCRP and IL-6 compared to refined grain controls. That distinction matters. It is not grain itself that drives inflammation. It is the processing that strips away the bran and germ, removing the fiber, B vitamins, and minerals that give whole grains their anti-inflammatory advantage. Oats, brown rice, barley, quinoa, and whole wheat all deliver beta-glucan and other soluble fibers that feed anti-inflammatory gut bacteria. The short-chain fatty acids produced by those bacteria modulate immune function throughout your body, not just in your gut. Replacing refined grains with whole grains is one of the simplest dietary changes you can make, and the clinical evidence shows it produces measurable reductions in inflammatory markers. Swap white rice for brown rice. Choose oatmeal over sugary cereal. Use whole grain bread instead of white. Each substitution shifts the inflammatory balance in your favor. Number 7. Garlic, the Allicin activator. Garlic has been used as a medicinal food for thousands of years, from ancient Egypt to traditional Chinese medicine. The compound responsible for most of its anti-inflammatory effects is allicin, which forms when garlic is crushed or chopped. Allicin inhibits the production of pro-inflammatory cytokines by blocking the NF-κB signaling pathway, the same master switch that green tea targets. Let crushed garlic sit for 10 to 15 minutes before cooking. This allows the enzyme alliinase to fully convert alliin into allicin. If you add garlic directly to a hot pan, the heat destroys the enzyme before the conversion happens, and you lose a significant portion of the anti-inflammatory benefit. Raw garlic delivers the highest allicin content. Add it to salad dressings, hummus, or guacamole. If raw garlic is too intense, roasting it whole at 400 degrees for 30 minutes mellows the flavor dramatically while retaining some of the beneficial organosulfur compounds. Roasted garlic becomes soft and spreadable, almost creamy, and can be mashed onto bread, stirred into mashed potatoes, or blended into soups. 2 to 3 cloves of garlic per day is a reasonable target for consistent anti-inflammatory benefit. Number 8. Tomatoes. The lycopene delivery system. Tomatoes are one of the richest dietary sources of lycopene, a carotenoid pigment that gives them their red color. Lycopene is a powerful antioxidant that neutralizes reactive oxygen species and reduces oxidative stress in tissues, including joint tissue. What makes tomatoes particularly interesting is that cooking them actually increases the bioavailability of lycopene. Heat breaks down the plant cell walls and transforms lycopene into a form that your intestinal lining absorbs more efficiently. This is one of the rare cases where processed food delivers more of a beneficial compound than the raw version. Tomato sauce, tomato paste, and roasted tomatoes all provide more absorbable lycopene than a raw tomato. Adding a small amount of fat, olive oil being the ideal choice, further enhances lycopene absorption because it is a fat-soluble compound. A simple marinara sauce made with olive oil and garlic is not just a pasta topping, it is a concentrated anti-inflammatory delivery system combining lycopene, oleocanthal from the olive oil, and allicin from the garlic. Number 9. Beans and legumes, the fiber powerhouse. Kidney beans, black beans, chickpeas, and lentils are among the most underappreciated anti-inflammatory foods available. Their primary contribution is fiber, both soluble and insoluble, in quantities that most other foods cannot match. A single cup of cooked black beans delivers roughly 15 grams of fiber. That fiber feeds the lactobacillus and bifidobacterium species in your gut that produce anti-inflammatory short-chain fatty acids. Beans also provide plant-based protein, folate, and minerals, making them one of the most nutrient-dense food categories per calorie. The Mediterranean diet, which has been studied in 33 randomized controlled trials involving 3,476 participants and shown to significantly reduce HSCRP, IL-6, and IL-17, features legumes as a core component. Canned beans are convenient and retain most of their nutritional value. Rinse them to reduce sodium. Add them to soups, salads, grain bowls, or mash them into dips. If beans cause digestive discomfort, introduce them gradually over 2 to 3 weeks to allow your gut bacteria to adjust. Number 10. Avocado, the monounsaturated mediator. Avocado is rich in oleic acid, the same monounsaturated fatty acid found in olive oil. Oleic acid competes with omega-6 fatty acids for incorporation into cell membranes, and a higher ratio of oleic acid in your cell membranes is associated with lower production of pro-inflammatory eicosanoids. Avocado also contains carotenoids, tocopherols, and phytosterols, a combination of fat-soluble compounds that work together to reduce oxidative stress. The fat content of avocado serves a practical function as well. It improves the absorption of fat-soluble anti-inflammatory compounds from other foods you eat in the same meal. Adding avocado to a salad increases your absorption of the carotenoids from the vegetables. Half an avocado on the side of any anti-inflammatory meal amplifies the benefit of every other ingredient on the plate. Slice it onto toast with a squeeze of lemon and a sprinkle of red pepper flakes. Add it to grain bowls, smoothies, or salads. The creamy texture and mild flavor make avocado one of the easiest anti-inflammatory foods to incorporate into meals you already eat. And unlike many supplemental sources of healthy fat, avocado delivers its benefits alongside fiber, potassium, and B vitamins in every serving. Number 11. Dark chocolate, the flavanol treasure. Dark chocolate with at least 70% cacao solids contains flavanols, a subclass of polyphenols that have been shown to improve endothelial function and reduce markers of oxidative stress. The cacao bean has one of the highest polyphenol concentrations of any food tested. Flavanols in dark chocolate modulate the production of nitric oxide in blood vessel walls, improving circulation in a mechanism similar to beets. Better circulation means better delivery of nutrients to inflamed tissues and better removal of inflammatory waste. The key is choosing chocolate with high cacao content and minimal added sugar, because sugar itself is pro-inflammatory and can offset the benefits of the flavanols. 1 to 2 ounces of dark chocolate per day is the range most commonly used in research. Melt it into warm milk for an anti-inflammatory hot chocolate, grate it over oatmeal, or eat it plain as an after-dinner treat. Look for bars that list cacao or cocoa mass as the first ingredient rather than sugar. The higher the cacao percentage, the higher the flavanol content, and the lower the sugar. If you find 85% or higher too bitter, 70% is a reasonable starting point that balances flavor with a meaningful polyphenol dose. Number 12. Tart cherries. The joint pain specialist. This is the food I mentioned in the opening. A clinical trial studying patients with inflammatory joint disease found that a tart cherry and citric acid combination consumed daily for 12 weeks reduced CRP by 42% and significantly decreased the frequency of acute episodes. A separate study in overweight and obese adults found that 4 weeks of daily tart cherry juice consumption reduced CRP by 19.4%. Tart cherries contain anthocyanins, the same pigments that give them their deep red color, which inhibit cyclooxygenase enzymes, the same targets that ibuprofen and aspirin hit. The difference is that cherries deliver this effect through food rather than pharmaceuticals, without the gastrointestinal side effects associated with long-term NSAID use. Drink 8 ounces of unsweetened tart cherry juice daily, or eat a handful of dried tart cherries as a snack. Fresh tart cherries have a short season in midsummer, but the juice and dried forms are available year-round and retain the anthocyanin content. Look for tart cherry juice concentrate, which allows you to control the dilution and typically delivers a higher anthocyanin dose per serving than ready-to-drink versions. Mix 1 tablespoon of concentrate into water or sparkling water for a refreshing anti-inflammatory drink that you can have any time of day. Number 13. Nuts. The omega balance. Walnuts, almonds, and pecans provide a combination of omega-3 fatty acids, vitamin E, and polyphenols that collectively reduce inflammatory markers. Walnuts stand out because they are the richest tree nut source of alpha-linolenic acid, a plant-based omega-3 that your body partially converts to the longer-chain EPA and DHA found in fish oil. Almonds provide the highest vitamin E content of any common nut, and vitamin E functions as a fat-soluble antioxidant that protects cell membranes from oxidative damage. A small handful of mixed nuts, roughly 1 ounce, provides a meaningful daily dose of anti-inflammatory compounds alongside healthy fats, protein, and fiber. Keep them unsalted and unroasted to preserve the heat-sensitive omega-3 oils. Store them in the refrigerator or freezer to prevent the oils from going rancid. Nut butters, particularly walnut butter and almond butter, are convenient alternatives that deliver the same compounds in a spreadable form. Add them to oatmeal, smoothies, or spread them on whole grain toast. The combination of protein, healthy fats, and fiber in nuts also promotes satiety, which helps with weight management, and excess body weight is itself one of the strongest drivers of chronic systemic inflammation. Number 14. Flaxseed, the lignin concentrate. A meta-analysis found that flaxseed consumption significantly reduces hsCRP and TNF-alpha, 2 of the most clinically relevant markers of systemic inflammation. Flaxseed is the richest plant source of alpha-linolenic acid and contains lignans, a class of polyphenols found in flaxseed at concentrations far exceeding any other common food. Lignans have antioxidant properties and are metabolized by gut bacteria into enterolactone and enterodiol, compounds with their own anti-inflammatory activity. The critical point about flaxseed is that you must grind it. Whole flax seeds pass through your digestive tract intact, delivering almost none of their nutritional value. Grind a small batch in a coffee grinder and store the meal in the refrigerator. Add 1 to 2 tablespoons daily to smoothies, oatmeal, yogurt, or salads. You can also use ground flaxseed as a binder in baking, replacing eggs in recipes for an anti-inflammatory upgrade that also adds fiber and omega-3s. Flaxseed oil is another option for salad dressings, but it should never be heated because the omega-3 fatty acids are heat-sensitive and oxidize rapidly at cooking temperatures. Keep flaxseed oil refrigerated and use it within a few weeks of opening. Number 15. Berries. The anthocyanin arsenal. Blueberries, strawberries, raspberries, and blackberries are concentrated sources of anthocyanins and other polyphenols that reduce oxidative stress and inhibit inflammatory enzyme activity. Blueberries in particular have been extensively studied. The anthocyanins in berries cross the blood-brain barrier, which makes them relevant not just for joint inflammation, but for neuroinflammation, the type of chronic, low-grade brain inflammation associated with cognitive decline in aging. Fresh berries are ideal during their peak season, but frozen berries retain the vast majority of their anthocyanin content and are available year-round at a lower cost. Add them to oatmeal, yogurt, smoothies, or eat them as a snack. A daily serving of half a cup provides a meaningful polyphenol dose. You can also mix berries into pancake batter, bake them into whole grain muffins, or blend them into a simple vinaigrette with olive oil and balsamic vinegar for a salad dressing that combines 3 anti-inflammatory foods in one preparation. The dark purple and deep red colors in berries are the anthocyanins themselves. So as a general rule, the deeper the color, the higher the anti-inflammatory compound concentration. Number 16. Ginger, the ancient anti-inflammatory. A meta-analysis found that ginger consumption reduces CRP by a weighted mean difference of 0.84 milligrams per liter. A separate clinical trial demonstrated that 12 weeks of 1 gram per day of ginger powder significantly reduced inflammatory markers in patients with knee osteoarthritis. Ginger's anti-inflammatory mechanism involves inhibiting the COX and LOX enzymatic pathways that produce prostaglandins and leukotrienes, the chemical mediators directly responsible for the pain, swelling, and redness you feel in inflamed tissue. Ginger also suppresses NF-κB activation and has antioxidant properties. Fresh ginger root can be grated into stir-fries, soups, and teas. Ginger tea is made by simmering sliced fresh ginger in water for 10 minutes. Dried ginger powder can be added to smoothies or used in cooking. The clinical trials used doses of roughly 1 gram per day, which is about half a teaspoon of dried powder, or a 1-inch piece of fresh root. Ginger also has well-documented anti-nausea effects, and its warming quality makes it particularly appealing during colder months when joint stiffness tends to worsen. Keep fresh ginger root in the freezer. It grates more easily when frozen, and the cold preserves its active compounds for months. Number 17. Extra virgin olive oil, the Mediterranean medicine. Extra virgin olive oil contains Oleocanthal, a polyphenol compound that produces the peppery, throat-catching sensation you feel when you taste high-quality oil. Oleocanthal has been found to share a mechanism of action with ibuprofen, inhibiting the same cyclooxygenase enzymes involved in inflammatory signaling. It also contains oleic acid and hydroxytyrosol, additional compounds with anti-inflammatory and antioxidant properties. The Mediterranean diet's demonstrated ability to reduce inflammatory markers across 33 randomized controlled trials is largely attributed to olive oil as the primary fat source. Use extra virgin olive oil as your primary cooking fat and drizzle it on finished dishes. Look for oils in dark bottles with a harvest date because the polyphenol content decreases as the oil ages. The stronger the peppery burn in the back of your throat, the higher the oleocanthal concentration. 2 to 3 tablespoons of high-quality extra virgin olive oil per day is the amount most commonly associated with anti-inflammatory benefits in Mediterranean diet studies. Use it to finish soups, dress roasted vegetables, or simply dip whole grain bread. It is the single most effective fat swap you can make for inflammatory pain management. Number 18. Fermented foods, the probiotic firefighters. Yogurt, kefir, kimchi, sauerkraut, and miso all contain live probiotic cultures that directly influence the inflammatory environment of your gut. Your gut is the largest interface between your body and the outside world, and the bacterial ecosystem living there, your microbiome, plays a central role in regulating systemic inflammation. Probiotic bacteria produce anti-inflammatory short-chain fatty acids, compete with pathogenic bacteria for resources, and communicate directly with immune cells in the gut wall to modulate inflammatory responses. A clinical study of 45 chronic pain patients found that 4 months of an anti-inflammatory dietary intervention that prominently featured fermented foods resulted in improved pain scores and reduced stress markers. Choose fermented foods with live active cultures, not the pasteurized versions that have had the beneficial bacteria killed. Eat a serving of fermented food daily. If you are new to fermented foods, start with yogurt or kefir, which are the mildest, before moving to kimchi or sauerkraut. Number 19. Fatty fish, the omega-3 powerhouse. Salmon, sardines, mackerel, and anchovies are the richest dietary sources of EPA and DHA, the long-chain omega-3 fatty acids that have the most direct anti-inflammatory effects of any nutrient studied. An umbrella meta-analysis of multiple systematic reviews found that omega-3 fatty acid supplementation significantly reduces CRP, with an overall effect size of -0.40. A separate analysis of 33 trials involving over 2,000 participants found that each gram per day of omega-3 reduces IL-6 by a weighted mean difference of 1.17 picograms per milliliter. Omega-3 fatty acids work by competing with omega-6 fatty acids for the same enzymatic pathways. When omega-3s dominate, the body produces resolvins and protectins, molecules that actively resolve inflammation rather than perpetuating it. The modern Western diet has an omega-6 to omega-3 ratio of roughly 15:1, whereas the ratio associated with lower inflammation is closer to 4:1 or below. Eating fatty fish 2 to 3 times per week is the single most effective dietary strategy for shifting that ratio. Bake or grill salmon, sardines on toast, or add canned mackerel to salads. Canned sardines and mackerel are among the most affordable sources of omega-3 fatty acids available, and they require no cooking at all. Open a can, place the fish on whole grain crackers or a bed of leafy greens, and you have a complete anti-inflammatory meal assembled in under 2 minutes. If you do not enjoy the taste of fish, a high-quality fish oil supplement is an alternative, but whole fish delivers protein, selenium, and vitamin D alongside the omega-3s. Number 20. Turmeric with black pepper, the golden compound. I saved this for last because turmeric has the largest body of clinical trial evidence of any food-derived anti-inflammatory compound on this list. Curcumin, the active polyphenol in turmeric, has been studied in meta-analyses of multiple randomized controlled trials. The results show that turmeric and curcumin supplementation significantly reduces CRP by a weighted mean difference of 0.58 milligrams per liter, TNF-alpha by 3.48 picograms per milliliter, and IL-6 by 1.31 picograms per milliliter. Effective doses in these trials ranged from 40 to 6,000 milligrams per day of curcumin, with durations from 12 days to 24 weeks. Curcumin works through multiple mechanisms simultaneously. It inhibits COX-2, suppresses NF-κB, scavenges free radicals, and modulates multiple inflammatory signaling pathways. Black pepper is essential because it contains piperine, a compound that increases curcumin bioavailability by inhibiting the liver enzymes that would otherwise rapidly break curcumin down before it reaches your bloodstream. Without black pepper, most of the curcumin you consume passes through your body without being absorbed. Add a generous pinch of black pepper every time you use turmeric, whether in cooking, golden milk, or smoothies. Golden milk is made by simmering turmeric powder, black pepper, and a fat source like coconut oil or whole milk together for 5 minutes. This is the compound that ancient Ayurvedic and traditional Chinese medicine practitioners prescribed for pain and inflammation thousands of years before a single clinical trial confirmed what they already knew. You now have 20 foods backed by clinical evidence for reducing the inflammatory markers that drive chronic pain. The pattern is clear: omega-3 fatty acids from fish and flaxseed, polyphenols from berries, olive oil, and turmeric, fiber from beans, whole grains, and vegetables, probiotics from fermented foods. These 4 categories form the foundation of every anti-inflammatory eating pattern that has been tested and validated in randomized trials. Start where it is easiest for you. If you drink coffee in the morning, add a cup of green tea in the afternoon. If you eat white rice, swap it for brown. If you use vegetable oil, switch to extra virgin olive oil. Small substitutions compound over weeks into a fundamentally different inflammatory environment inside your body. Smash that like button if this video gave you a new tool for managing your pain. Drop a comment and tell me which food you are adding to your kitchen first. I read every comment and your stories keep this channel going. And if you have not subscribed yet, click that subscribe button and hit the bell so you never miss a video.